Hey everybody, welcome back to the show. Usually our next guest is coming here to tell us about his great and somewhat gory books.
Yeah, somewhat, yeah. He's got a new one in the works as well, and we'll talk about that a little bit. But today he's here in his role as an ER physician here in Vancouver. Dr. Daniel Kalla is joining us. How are you, Daniel?
Great.
Nice to see you.
Thank you.
A little weird talking about your first profession instead of your second profession.
Yeah.
We usually have you talking about your books. We're going to talk about your role as an ER physician today. And the most common complaint, we asked you for a list of the most common ailments people come into an emergency room with. Number one was?
Well, chest pain. It's right up there. I don't know if it's number one, you know, by volume, but it's certainly
one of the
a huge
most common
percentage.
indeed.
Yeah.
And how many people who actually come into the ER with chest pains are actually having some sort of serious problem with their heart or other ailment?
About 98%. No, I made that up.
Oh,
It's actually it's a fraction.
Is it?
But it's a very scary symptom for people who've never had it before. Immediately assume they're having a heart attack.
Now, what kind of pains do people have? What kind of symptoms should they be looking for actual heart attack symptoms? Because of course people can mistake even things like acid reflux for chest pains. But what are the symptoms of a heart attack that we should be aware of?
Well, first of all, pain's a bit of a misnomer because what people described often with a real heart attack is a pressure, a squeezing sensation in their chest. And some people, you say, do you have pain? No. Do you have pressure? Yes. Often it's agonizingly uncomfortable, but it's the classic symptom is feeling like an elephant sitting on your chest, that weight.
Right.
And it
not
makes,
necessarily like a sharp piercing pain.
No, exactly. In fact, that's rarely heart attack pain. And it usually is, it's often accompanied by pain that radiates to both arms, especially the left arm. And often people are sweaty and feel very nauseated and feel short of breath and just feel generally unwell, like something very bad is happening.
And when people have any of those symptoms, this starts becoming a bit of a race against the clock.
Absolutely, yeah. We have a saying in medicine that time is muscle. And that's because, a heart attack is a blocked artery that supplies an area of the heart muscle. And that heart muscle will die if it's not reperfused, if you don't get the blood flowing back to it. So the sooner somebody gets into the emergency with a real heart attack, the sooner we can try to open up that artery and reverse the damage.
Now, you always hear heart and stroke hand in hand. What is the difference between a heart attack and a stroke? Because a lot of people don't know.
Yeah, well, the classic stroke and classic heart attack share the similarity that they're both occluded artery. But in the case of a heart attack, or myocardial infarction as we call it, that's an occluded coronary artery to the heart, whereas a stroke is an occluded cerebral artery, an artery that supplies part of the brain. But it's the same underlying mechanism, just different area of the body.
And both need to be treated really quickly.
Yeah.
What are some other things that would cause people to have that idea of chest pain and that feeling?
Panic
that they
attacks.
Need to
Panic, oh, that's a very
emergency
common.
I've had that happen. I thought I was having a heart attack.
And that's one of the symptoms of a panic attack. You get chest pain.
Absolutely.
I've never heard that before.
Yeah, often. In fact, stress is one of the most common causes of chest pain. So we see that all the time. People who are anxious, even people who aren't normally anxious but develop a panic attack, have that sense that they're dying and develop this chest discomfort that brings them in.
Does it have shortness of breath as well, or do heart attacks as well?
Can have anything with it. I mean, people develop pretty much every symptom, but often there's that racing heart, what we call palpitations, sweating, a sense they just can't get a good breath.
Yeah.
And
I'm starting to see why so many people end up in the emergency room with chest pain, because for the common person it would be very confusing about whether, is this something I can deal with on myself, or do I need to get in and see a professional?
Absolutely. But there's an advantage, and I'll give away the secret to the public. There's an advantage. Chest pain gets you to the front of the lineup, right? So if anybody out there who's sprained their ankle or cut their finger, you just say, well, that's gone away, but my ankle's really sore now.
What about acid reflux? Because that's another one that can have the similar sort of
Absolutely.
chest
In fact,
pains.
it can have the exact same symptoms. That's the interesting thing, because it's the same nerves that are affected. Your body's not used to feeling nerve sensation or pain from the heart or the esophagus where the acid reflux is, and it's the exact same set of nerves that are firing, and so your brain might have the same perception of feeling acid reflux as it does with a heart attack.
I don't even know what leads to acid reflux. I mean, I know it can be a chronic condition in some people, but if it's not chronic, and what leads to it? Is it overindulgence? Or?
No, not necessarily. It's usually like an incompetent valve at the bottom of the esophagus.
Damn those incompetent valves.
I know.
There's one in everybody.
I know.
Really? Is there something you wanted to tell Dr. Kalla?
I'm not going to tell you which valve, but there's one in everybody.
I knew we'd get here eventually.
Okay, so say somebody next to you says they have chest pains. They have everything that sounds like it. How should you react? What is the best thing to do when you think someone's having a heart attack? Run.
Run, yeah. Panic. Move seats. I think, you know, you need a degree of common sense, right? If somebody's 24 years old and feeling very anxious, develops chest pain, and they're an otherwise healthy person, the chances are almost non-existent that they'll be having a heart attack. If somebody's older, and you know, the big thing for what we do when we see patients is we risk stratify. That means we have no 100% test short of putting a catheter directly in the coronary artery in what they call angiograms and looking to know for sure if it's a heart attack. But so we look, yeah, we go through the risk factors. First of all, are they older? Do they smoke, which is the #1 risk factor? Do they have high blood pressure, high cholesterol, diabetes? Do they have a family history, which is very important? So if the more you have of those things, the more likely it means that you're probably having the real bill or heart attack.
Then you're in a race and get them to the hospital.
I'm not suggesting you should do full medical histories and physicals on people you're sitting beside on a plane, but there are times to worry, you know, certainly.
Times to rush to the hospital.
And people who have a history, they say, I've had angina before. This feels just like that, except it's not going away. That's a worrisome sign.
Then you know. We, of course, would be remiss if we didn't ask you what you're working on. Cold Plague, your last book that came out. I loved. This was such a great book, but you're making a bit of a departure in what you're working on now.
I'm trying to kind of broader canvas, as it were. I've got a book called Of Flesh and Blood, which is written, but it's not coming out till early next year. And it's kind of an epic story about one fictional family that started and continued a major sort of West Coast Mayo clinic, and the hospital's running into a crisis in current day, and it goes back and forth between the current time and the 100 years of founding it, and why they've ended up that way.
How much research goes into a book like this that has that historical element to it?
Huge. I mean, I had no idea. Like, I didn't know a lot about my 19th turn of the century stuff. I didn't know if they, were cavemen or whatever. Like, I had to figure out what electricity had, what hospitals looked like, what medicine looked like at the turn of the century. But it was fascinating.
It must have been a really interesting glance into the history of your profession.
Because it was a kind of a golden age of medicine. Things were just coming to the fore. They were learning about germs and surgery and sterile technique and all kinds of stuff that was just amazing. So
cannot wait to read it. Of course, you can go to danielkalla.com to find out about all Daniel's work, and then if you happen to be in an ER, yeah, it's him. Just tell him you've got chest pains, even if you've got broken foot. Works every time.
My knee's a little sore. Oh, and